When Children at Risk was created in 1989, it was founded by physicians, social workers, and philanthropists with the idea that we need more data, more indicators of what's really happening with our children. So our idea then, as it is now, was to use data and statistics to figure out where our children stand and how their lives can be made better through evidence-based programs and best practices. Our children are our most important resource, and because this group of advocates came together, Children at Risk have more of a voice than ever before. When you're talking about the whole child, having a specific objective sometimes becomes difficult to define because we focus on a few key areas. At this time, our top focus areas are public education, child trafficking, food in the schools, and creating a parenting movement. Those are probably our biggest and certainly most prominent goals. For us, it's a matter of raising awareness on these issues, searching for best practices, and really building a collaborative movement around each of them. For instance, in public education, it's not an easy fix, but we want schools to have longer school years, longer school days, and we want effective public school teachers. We want children to realize that public education is historically the way that a child has moved from one economic class to another. Grassroots change like this doesn't happen overnight. However, Children at Risk knows that we can do it by using the data, collaborating, and generating public awareness. I think for us, leveraging existing data, using evidence-based policy, and changing the big picture are what make us successful. Children at Risk is consistently viewing issues at the macro level for children. I also think what makes us effective is that no one else is doing the things that we're doing in the way that we're doing them. One of our main initiatives is to work with groups and organizations to improve, but not duplicate their work. This ensures we have partnerships statewide to drive change for children. So when we move to change things, it's a matter of building collaboration, building relationships with universities and partners across the state, growing awareness in the media and in the community. When we use all of these levers in unison, we're able to affect change. Children at Risk is effective because our model works. Very simply, it helps us identify issues through data and research, community meetings, and public official meetings. Once the issues are identified, then we tackle them on a macro level. We achieve the goals we set in place because of the established relationships we've built and our hard work. We also have a reputation in the community of being a change agent for children. In 2006, Children at Risk took on the issue of child trafficking. Through our work to engage the community, spread awareness, and enact legislative change, Texas has become a model state in regards to laws regulating human trafficking. While it took years of research, collaboration building, and community awareness, we've effectively created a safer, more successful outlook for children. We measure success in several different ways. First, we measure it through the number and strength of pieces of legislation passed. We measure it through the number of community stakeholders, public officials, philanthropists, and parents that we educate each year. We look at our success through the awareness that we build in the community from media hits, op-eds written, and partnerships gained. We measure our success based upon the number of collaborators we have. We also measure success through our growth as an organization and how our reach has stretched beyond Houston and the state of Texas. Most importantly, we measure success through how we positively impact the lives of children. The great thing about Children at Risk is that we strive to never duplicate the work of others. Some people may not realize that we don't provide direct services. This unique feature of Children at Risk means that we're not competing for direct service dollars and that the work we do enables the successful outcomes of other programs. We're happy to take this role because it's our belief that there are many organizations doing significant and amazing work for children. As we take on the role of convener, we can bring organizations together to enhance their work and continue to improve the lives of children. Children at Risk has seen monumental legislative success. We've co-authored or had a hand in every piece of human trafficking legislation in the state of Texas. We're responsible for helping to establish the first juvenile mental health docket in Harris County. Children at Risk has launched an online peer-reviewed academic journal focusing on applied research and evidence-based policy solutions for children. We've called awareness to the dropout rate and released public school rankings results across the state of Texas. We've increased the number of school districts that provide universal, free school breakfast to their students. We've brought together universities, organizations, and stakeholders across the state to pull their resources together and work together to change the lives of children. Moreover, we've seen these crucial changes truly impact and improve the lives of children. Recently, Children at Risk has experienced extreme growth and expansion. We see this as a good problem. However, it's presented us with some exciting challenges. We've grown from an organization that started in Houston to one that works statewide and continues to find opportunities across the nation. And so, while we're so excited at the many opportunities that stand before us, we're aware that with growth comes more responsibility. Our growth enables our work to reach farther and to help improve the lives of more children. As we grow and expand across the state and across the nation, we'll continue to face this exciting challenge. There are so many key issues affecting the welfare of our children that we haven't had the time, the staff, or the resources to tackle. With additional funds, we could spend more time promoting the need of parks for children, tackling health issues like dental care or teen pregnancy, fostering child abuse prevention strategies. We are interested in so many issues. We've considered problems associated with the children of immigrant families. Key parts of our population are living in poverty, and the connection between poverty and the lack of success are things that need attention. With the support of additional resources, there are many issues that we'd really like to change. There are so many issue areas that truly affect the well-being of our children that we currently don't focus on. For instance, there's a real need in Houston and in Texas to look at and address the incredibly huge needs of children of immigrants. Plus, there's a need to address teen pregnancy, dental health, and even more that we can do in areas in which we are currently working. The list of issues we could tackle is endless. Children at Risk is a natural fit for many of these issue areas, but because of time and lack of resources, we are currently unable to do so. However, Children at Risk is the catalyst for change that could really make an impact in these areas, and with your support, we will move forward changing the lives of children at risk.